research should I be aware of? So this gets into where the field is going next. And I have to say, as a sarcoma doctor, this is exciting. It's a growing field with new options. It feels like every month or even every week. And a lot of this is based on the concept of precision medicine. And I've got a little infographic on the left side of your screen here. This is from the National Cancer Institute. We look at those genetic or molecular markers, and then we try to match those to the appropriate treatment. And so for simplicity's sake, if you have the purple marker in your genes, in the cancer's genes, then we would give the purple drug. And if you have the green marker in the second row there, then we'd give the green drug, and so on and so forth. You can imagine it's a little more complicated than that, but the concept is the same. We want to match the treatment to the genetic abnormality. In sarcoma, sometimes that's based on, again, genetics or molecular features, and sometimes it's based on the subtype. And so here are a couple of exciting examples of this precision or targeted treatments that we use in sarcoma today. Pembrolizumab, which is a kind of immunotherapy in combination with radiation, has been recently shown to improve outcomes with patients with a certain type of sarcoma called undifferentiated pleomorphic sarcoma. Trabectedin is a particular type of chemo that's been shown to work just as well with way less side effects than the typical chemo for something called myxoid liposarcoma. IMTs are a rare kind of sarcoma that can express a gene called ALK. And when we see that, we can treat it with pills, pill-based therapy that was first developed in the lung cancer space, and now we've shown can work really well amongst patients with this particular sarcoma. One of the most exciting is a new T-cell therapy called afami-cel, which is a one-time treatment that engineers the patient's own immune system to attack the cancer, and that's been shown to be effective for synovial sarcoma when the genes express, or the cancer cells express, MAGE-A4. That's a really exciting one. We have a new FDA approval for that medication, and is really a breakthrough in that disease. And one last one to mention is not a chemo option, but a targeted therapy called nab-sirolimus that we can use for, again, a rare subtype called PEComa, and that is particularly effective amongst folks with certain genes expressed in the tumor, such as TSC1 or particularly TSC2. So I want to leave you with some take-home messages here, which is that sarcomas are very rare and they have a wide range of behavior. And so if you or your loved one is facing one of these diseases, don't go on the internet and read a bunch of stuff, because somebody else's experience is likely to be very different from your own, because they can behave so differently from one to the next. You should be seen somewhere with expertise and experience dealing with these rare cancers. Surgery is absolutely critical and is, I consider it, the mainstay of treatment. We should be looking for that molecular or genetic testing whenever possible. And really, this is an exciting field with a growing number of treatment options. I want to thank you for your time, and I appreciate the opportunity to talk to you today.